The Federal Health Department has sent hundreds of warning letters to GPs saying they've been incorrectly billing Medicare for patients with chronic diseases. The government says patients are losing out on subsidies as a result. The Royal Australian College of GPs says the letters are appallingly vague and says they should be withdrawn. Let's talk about this now with Dr Margaret Faux, whose doctorate focused on Medicare claiming and compliance. Dr Faux joins us now. Good to see you. Thanks for joining us. Can you first just explain what is it exactly that the government is saying GPs are doing wrongly?
So this is part of the government's standard compliance activities. What they've done is sent out letters to approximately 600 GPs, warning them that it appears that they are claiming incorrectly by co-claiming two item numbers together that shouldn't go together.
So is it essentially an allegation of double dipping?
It's not double dipping. It's non-compliant claiming. So Medicare works so that you claim for the service you provide. If you didn't provide the service, you can't claim it. And the two item numbers are one for a chronic disease management plan and one for a nurse reviewing and supporting the implementation of that management plan. But the bottom line is you can't really be supporting a management plan that you've only created 5 minutes ago. So that's the problem, that they're claiming to support and review a plan, but they've only just created the plan or have just reviewed the plan. So there's a doctor item and a nurse item, and they're claiming the two of them together.
Is this sort of compliance activity, is this normal for Medicare, or is this an abnormal sort of process that's been launched?
No, this is absolutely normal. This is part of the government's compliance initiatives. They're often referred to as nudge letters. So what they do is they send these letters out to GPs where they've looked at the analytics in the data and seen what they would describe as non-compliant billing, and they will send these letters out to practitioners to just alert them to the fact that they appear to be claiming incorrectly. But the key issue here, I think, is that there is no penalties imposed for doing this. And I think that that's a really important point that came out of the article in The Guardian today, which is that if you or I, for example, parked illegally in a no stopping zone, we wouldn't get a gentle letter saying, look, we know most people like to park legally, but every now and then they don't. We're just letting you know that if you do it again, you might get a fine. I mean, this is public money. This affects patients' ability to access and afford the health system that they pay for. And really what should be happening, in my opinion, and supported by the evidence, is that you need to come down much harder on this, not with these sort of gentle letters and reminders, but to say, if you do that, you will be fined. And we need to be doing something very substantial to bring payment integrity into line in Medicare very, very quickly, because it is currently hemorrhaging and out of control.
Dr Faux, I might put what the Royal Australian College of GPs has said today to you and see what you make of it, because they're saying doctors who have got these letters, they're shocked, they believe they are following the rules, and they've said there's too much ambiguity around the claiming rules. What do you think? Are the Medicare rules too complicated for doctors?
Look, Medicare is incredibly complex, absolutely incredibly complex, and we need structural reform. But these items are not complex. These items are, in my opinion, very clear in the sense that the co-claiming of the nurse item, it's very clear in the notes that these are designed to have a bit of a catch-up with the patient in between the more structured reviews. Now, someone with a medical degree, I think, should be able to understand that. I do not think these items are ambiguous. And I think the other point that came out of the Guardian article today is that the RACGP GP was saying, look, our patients are really complex. We have really diverse populations. This is all very hard and difficult. And no one is disputing that. No one. We're not saying patients aren't complex. We're not saying chronic disease isn't hard to manage. We're not saying you don't do a great job. What we are saying is that that doesn't give you permission to break the law. And the government has an overarching responsibility to maintain the integrity of the Medicare system because it's taxpayers' money. So I welcome these initiatives by the government, but they aren't really making a dent in the problems that Medicare is facing. We need to get much tougher on the way we police the Medicare system, and something like fines and penalty points is something that is supported by the evidence and should be considered.
And just very briefly, Dr Faux, the RACGP have also said, well, they've compared this kind of compliance scheme to the robo-debt scheme. They've said it's a scattergun approach of letters that have been sent out to 600 GPs. The onus has been put on them to prove that they've not broken rules rather than the other way round. Is there any merit to that?
Look, we need to do structural reform of Medicare. You know, a root and branch reform of Medicare. It is very complex. It is very broken. It is hemorrhaging. But the bottom line is, I think just going back to basics, these item numbers, these particular item numbers that the government has targeted are not complex. It says very clearly that the nursing, management and support items are designed to be used in between the structured reviews and care plan initiatives that the GPs implement. That is not complex to understand, and it's not complex for someone with a medical degree to understand. So yes, we need to do root and branch reform of Medicare, definitely, but I don't believe that it is correct to say that this was unfair, scattergun approach. And in fact, the Guardian article said that the department had drilled down deep into these item numbers, into the data, and they didn't target GPs who they felt were legitimately co-claiming those item numbers. I read the Guardian article today myself, and the department's response was that they had been very detailed in their analysis, and these particular practices were outliers, significant outliers, and that is why they were targeted. So look, it's a complex problem. We're not going to solve it overnight, but root and branch reform of Medicare is required, and we probably at some point will need a Royal Commission into health financing in Australia.
All right, Dr Margaret Faux, thank you.